Brachytherapy, in the same way as any other radiation therapy modality, relies very much on image. The best outcome are achieved when we can escalate dose and when we can have the right precision where we deliver the dose. For that, imaging have a crucial role, and having that in an adaptive way where we can see, we can adapt if something is not right until the last moment of delivering the dose is very important to be precise. With that, we can expect much more accuracy, and with that, improved the outcomes. The most important in brachytherapy is to know where we will deliver the dose, and for that, imaging is extremely important. If we can see both the anatomy but also where the source will be, it will help a lot the clinicians in the precision and accuracy of the treatment. I would say that is one of the biggest challenges, to see where we treat, and is where brachytherapy can definitely outperform comparing with other techniques. So when you use imaging for brachytherapy, usually you need to move out from the room, because the diagnostic image devices are usually in different departments. Could be in the different floor, could be in the different department, could be in the different building. So to have access to image sometimes is a really struggle. Having image in room could simplify very much the process. So definitely the big benefits to have in-room image, I would say there are three mainly. One of them is related with resources and people, so the staff in the hospital and access and availability of that staff. The second one is related also with resources, but in this case with equipment, so getting access to image devices. Again, they can be in different departments. And the last one is very much related with the patient, so the comfort of the patient, the accuracy of the treatment, not having to move the patient in between the procedures through the hospital and in different rooms will benefit a lot. So I would say improving accuracy, improving safety, giving a better comfort for the patient, optimizing resources, being staff and equipment. Having the imaging ring inside the brachytheater allows the clinicians to not have to move the patient out that room. So they can insert the applicator image guided, so they can see the anatomy before and after and even during the insertion of the applicator, and with that we can be more precise and they can increase the accuracy in the placement. Brachytherapy depends a lot on how good is the implant. During the treatment or during the treatment planning, imaging ring could provide and can provide the image to do the plan. So we don't need to move the patient to other room to have a CT image, for example. So they can be just in the same room, making the timing of treatment more shorter, and with that also improving the accuracy because we are not moving the patient. Definitely can also improve the efficiency for the hospital because it will optimize the use of resources. So having less people involved because they don't need to go with the patient through the corridors until the CT department, it will reduce the time, it will reduce the need of people involved in the treatment. Also, using the imaging ring that is in the brachytheater frees some slots in the CT of the hospital. So at the end you can treat more, you can take care of more patients with the same people. What makes Elekta Studio unique is the combination of the different brachytherapy product portfolio from Elekta, being the afterloader, the treatment planning, the applicators and the imaging ring. The imaging ring itself, it's a unique system because of a large bore that allows the clinicians to do the brachytherapy procedure without having to move the patient position. Not only in between rooms, but also during the treatment, it doesn't need to change a position to be delivering the dose. We talk about cost efficiency and how we can improve treatments still having in consideration the cost of the healthcare. Imaging ring provides several benefits, being at the level of the patient, the staff and the equipment, and that I think is very important for all the departments.